the bell, and thanks for watching. Appreciate you as always. Perry Corey, MD, Medical Musing. Policy shift against the mRNA platform rapidly emerged this past week. Major COVID mRNA policy reveals an awakening occurred this week within a major U.S. health system, a large U.S. South, a South American country, and in the UK. The dominoes are starting to fall. September 17, 2024. Ohio State University Wexner Medical Center. This week, a nurse reached out with a disturbing description of some major changes she witnessed inside the Ohio State University Medical Center system. OSUCM MC, a large and comprehensive healthcare organization with a significant presence in Ohio and a strong focus on research, education, and patient care. It is a massive institution with over 23,000 employees, including over 2,000 physicians, more than 1,000 residents and fellows, nearly 5,000 nurses. Let's start off with this screenshot of a web page from OSUMC's website, which provides information to the public as to where they can get COVID-19 vaccines. Check out the highlighted sentence at the bottom of the page. So I need y'all to pay very close attention, because this is going to show you that the system, doctors, nurses, those who are left in this system evidently don't have any kind of loyalty to their oath of service to take care of people. So let's look and see what they're saying. So we see here, this is the Ohio State website. It says COVID-19 vaccines now available. Find out locations, schedule options. Published a day ago. Hub. COVID-19 vaccines are now available for everyone age 12 plus at Ohio State. Then it says at the following Express Care locations: Express Care Outpatient East, Care East, Express Care at Matt Campbell, Outpatient Care, Express Care at Outpatient Care Upper Arlington, Express Care at Outpatient Care Worthington. Schedule now through my chart. Note: if you want to get your flu shot and COVID-19 vaccine at the same time, you must schedule my chart for COVID-19 vaccine. Then you can verbally request a flu vaccine once you have your appointment. It says anyone age 18 plus can get a walk-in COVID-19 vaccine at Ohio State retail pharmacies located Care Dublin and Outpatient Care New Albany. Now, this is the very most important part. Please tell me what you think about what I'm going to show you. If you don't think this is strange, if you don't think something's wrong with our the whole medical system's changing. Watch this. Do they even care about our children? The medical center is not offering the COVID-19 vaccine to its employees. So they're telling the kids, come get your COVID vaccine, 18 plus. So this is university, this is college, right? But the medical center is not offering the COVID-19 vaccine to employees. Okay, so let's see what the writer said. He says, wait, what? Ohio State is suddenly no longer offering the COVID-19 vaccine to any of its employees, but they are happily offering it to inject them into the public? How can such a policy be justified? Why was this change in policy done, and why was it done so quietly? Let's get this straight. Ohio State's leadership is now making an institutional decision that employees should not be offered access to any COVID-19 mRNA vaccine. I am confused. Pretending to be. I mean, if the vaccines could protect patients from being infected by staff members and they were safe to give to staff members, why wouldn't you do anything possible to ensure they receive them? Like a mandate. Is that what he's saying? The only possible reason for the action above is that either OSUMC leadership recently discovered, y'all, A, B. He says, I think you would agree that of the two possible answers, the only one that makes sense to explain this abrupt change in policy is B. I say this because if they were, but instead just didn't really very well, Ohio State would not have the incentive to divorce themselves so abruptly and strongly from the recommendations of benevolent federal government. I believe such an action would be pretty quickly and negatively impact federal funding, research funding by the NIH. It is my belief that agency's money kept the nation's 126 major academic medical centers in line throughout the pandemic. Also, CEOs and deans are well aware that NIH retaliation in terms of rejecting grant funding if they dissent is real and happens. Inflated retribution from the government wasn't another one of the course. So it says, I asked the Brave browser AI, why is Ohio State Center no longer offering COVID vaccines to its employees? 2 sentences jumped out. So this is what the AI told him. Everybody depend on the AI, huh? I think not me. But let's see what the AI told him. Number 1, based on the provided search research, it appears that Ohio State Medical Center did offer COVID-19 vaccines to its employees at one point. Number 2, without further information on clarification from Ohio State Medical Center, it's difficult to provide a definite answer on why they may not be offering COVID vaccine to their employees. So, it must be the case that Ohio State leadership somehow found themselves a stronger financial disincentive to subjecting employees to. Where would such a disincentive come from? Answer: lawsuits. I also suspect the fear of worsening staff shortages from disabilities / further disrupting operations played a role as well as, learn below, he says. So it says this new policy action taken very quietly is absolutely damn breaking to me in terms of progress towards the truth about the mRNA platform getting out to the public. It is also appears ethically repulsive. Example, the institution made the decision to keep jabbing the public with while becoming aware that the same is either exposing them to unmanageable legal risks and or disrupting their operations by negatively impacting the health of their workforce. Welcome to dystopia. And he goes on and on and on. All right, what do you think? Why are they not giving it to their people? Let me know. Put in the description. Comment, like, subscribe the bell. Appreciate you always for watching.